45-year-old South Sudanese refugee Rose Adjumani knows how damaging HIV can be. She's lived with it for 20 years. Her husband infected her and then died of AIDS, leaving her to care for herself and an HIV-positive daughter.
I have other children. Because of the difficulty of the cost of school, most of them got married when they were still young. There was nobody to pay for their school fees.
Poverty is the biggest challenge for HIV-positive refugees in Uganda like Adjumani, who acknowledge their status and get treatment. But Ugandan health workers in Adjumani district say fewer than 1,000 refugees are on record as being HIV positive, while at least double that number are believed to be infected. They blame ignorance for many refusing to be tested or dismissing test results.
They have beliefs that HIV and AIDS is a disease of Ugandans and it may not affect them as South Sudanese.
In 2015, health workers in Adjumani district recorded fewer than 200 cases of HIV. But that number has more than tripled after the influx of some 200,000 South Sudanese refugees fleeing years of war and conflict. Refugee flows to and from Uganda make checking the spread of HIV a challenge.
When you start somebody on treatment, they first go to Sudan, the other side. So they come back after some time when they are very ill. So it becomes very difficult in terms of control. Also, again, that has contributed to resistance.
2/3 of HIV-positive refugees are women whose families rely on them for a dowry payment from a prospective husband when they marry.
So once you diagnose a female as having HIV, it's like you are depriving them of having wealth from this affected woman. We have had scenarios where it became very difficult for the counselors to declare results to some of these communities, especially the females.
Ugandan health workers say the challenge is in educating the uninformed and those in denial on the need for treatment to prevent HIV from spreading to more vulnerable refugees. Halima Athumani for VOA News, Adjumani, Uganda.